All right, the best conversations happen at happy hour. Welcome to Hours. Another episode of the PT Pintcast starts right now. Our next guest, I'm going to bring on the screen right now. No stranger to the show, Dr. Leslie Waltke. Leslie, welcome back to the program.
Hi, Jimmy. Thank you very much. Glad to be back.
Wanted to bring you in first and foremost to say thank you. We had a fundraiser not long ago, and you and I share a deep love for things pint glass. So yours are coming in the mail. I will throw them in the mail tonight. This is what it looks like. You'll be able to drink out of it shortly. It says I drink it. I know things. We're doing that for the Multiple Myeloma Research Foundation for the Ironman. So thank you for jumping in on that. That was real nice of you.
Yeah, my pleasure. Love pint glasses. Can't have too many.
Honestly, I'm pushing it though. Yeah. Although I agree, you can't have too many. It just feels like you're really drinking out, even if you're drinking milk, it's just got a little heft to it,
Yeah. Well, I'm the Diet Coke girl, so there we go. Where is it?
Keep it strong.
There you go.
There you go. Love it. So last time we had you on the show, we talked about oncology physical therapy and where it crossed with something I love, which is triathlons and a program that you ran. Just so you know, I've pushed several clinicians toward looking up your program to get other people involved. So talk just for a second, just rehash it, because I think it's a killer program, where people can find it and what you guys actually do in that program.
All right. So it's called Team Phoenix. And it was started in 2011. And it's actually a triathlon training program for female cancer survivors right now in the southeastern Wisconsin market. So it came out of a need that we know that the average American does not exercise enough. Okay, the average cancer survivor, even though it's even more critically important for them to exercise, it literally will change the length of their life, the quality of their life, and even can reduce risk of dying of cancer. Okay, even with those positive benefits, they exercise even less than the average American that doesn't exercise enough. So we have a big problem. We're really good at keeping them exercising while they're under our cancer care window, but once they step away from that, they tend to fall off of their exercise routine. So I work with a bunch of really, really awesome and very progressive people. And our breast surgeon came to me one day and said, "What do you think about creating a triathlon program?" And I said, "You're absolutely insane. Let's try it."
Love it.
But 8 years in retrospect, we've had 262 people go through this program. In retrospect now, it's absolutely brilliant. And we've learned, we've combined with some researchers at some local universities to do research on this. So both from a physiological, cytokine, biomarker kind of thing, as far as well as health metrics like blood pressure, body weight, that kind of stuff. But we've also looked at the data from a behavior change perspective. And that's really what we're trying to do, is change behavior long-term.
Yeah.
So in a nutshell, what we've learned from this programming from behavior change status is, number one, our program is medically overseen. So at every training, these people will have them train twice a week. It's a 14-week program. They train twice a week together. And it's medically overseen. So there is a physician. There are multiple physical therapists there. So these people feel safe. It is professionally coached. So we have people that know what they're doing. They're professional triathlon coaches.
It's legit.
Yeah. And then because it is multi-sport and because we teach these people how to exercise, they have built the skill set to be able to do it on their own and continue it. So there's cancer exercise programs are now a dime a dozen, which is fantastic because they're really good. They're necessary. But if you go to a 10-week class, you show up on Saturday mornings, you exercise, and then you leave, makes you healthier, but it doesn't change how you think and who you are and how you plan. So by teaching people how to get their front wheel off of their bicycle so they can get it in the car, how to pump up a tire, how to pick out a good pair of tennis shoes, places all over the community to run, places to swim, how to swim, how to improve your stroke, and then even things like what to put in your gym bag. So when you're tired and you're cranky and you just want to go home, that you've got, oh look, I have a banana and some grapes. Great, I'll eat that instead of going through the McDonald's drive-thru.
Yeah.
Skill sets really, again, teach people how to be an athlete versus just exercise. And then finally what we've learned is that goal-oriented piece to this exercise program completely was a game changer. So again, if you just go to an exercise class Saturday mornings for 10 weeks, that's great. But there's no skin in the game. Where when you sign up for this triathlon training, you know that at the end of this 14 weeks, you have to swim between a half and a quarter mile, you have to bike for 15 miles, and you have to do a 5K.
Yeah.
It completely changes the thinking, structured thinking from I'm going to exercise versus I'm going to train. And then
instead of just telling them to do it, you're walking them through it.
Yeah. Yeah. And then because they are exercising with people that have been through somewhat of a similar experience, that they feel more encouraged and they can inspire, they can be inspired, they can inspire others. And that again is a very motivating piece for our people. And it is just absolutely incredible. And we literally target people who are overweight. We target people that don't know how to swim. We target people that haven't been on a bike in 30 years. So we're trying to get the non-athlete person to turn them into an athlete.
Yeah,
I love that. We refer to our program participants on day one, we refer to them as athletes. And
good.
Many of them right away, they just, you can see them stand up a little taller and kind of walk a little different. And wow, I've never been called that before. So again, it just changes literally, it intercalates into their DNA and 80%. So I think the average, typical national average for cancer survivors exercising is about 17%. Our program graduates, 70% are still exercising at or above the 150 minutes per week guideline from the American Cancer Society. So it's very, very powerful. Plus it's really
what was that number again? In 8 years, how many athletes?
We've had 262 go through the program. We started really small. Our first crew was 11 people, and they were kind of our guinea pigs. We just kind of made things up as we went along. This past year, we had 51, and it is a well-oiled, solidly running, incredibly beautiful program. So it's really neat.
Good for you, Team Phoenix. Good for you. Yeah, I've pushed several people to go check out more information. I think it's exactly what you said, right? I mean, you're talking about lifestyle change. You mentioned the Saturday morning exercise class. That's great, but what do you do the other 167 hours of the week? Right. What are you supposed to do? So instead of just saying, "Hey, I'm a physical therapist, you should exercise," you're saying, "Hey, not only should you exercise, but I'm going to put you in touch socially. I'm going to get you with professionals so you're medically sound, but also I'm going to get you with coaches so this thing's fun and you're doing the right thing." Little things like you mentioned, like taking your front wheel off to get your bike in the car. You don't do that. Maybe you don't live in an area where you can ride right out of your house. Maybe you've got to get somewhere where you're saying, "I'm going to remove that barrier. I'm going to teach you how to do that." That's fantastic.
Yeah. And we do. We remove barriers. If you have a bad ankle, go see the PT. If you don't know how to swim, we're going to teach you. If you don't have a bicycle, we literally partner with a local biking store, and they literally will give our people bikes to use for the season. Wow. They put a $150 deposit down, and if they don't want their bike at the end of the season, they give it back. They literally get their $150 back. I think it's actually $100. And if they want to buy the bike at the end of the season, they get to buy it for a used price because they used it all summer.
They used it. Wow, you guys have this top down.
Yeah. So it is. We will remove every possible barrier that you can think of. We've had people that have diabetes. We have people that are 350 pounds. We have people that had just had a knee replacement that are pending for hip surgery. We've got people with stage 4 disease. Brain mets, lung mets, liver mets, you name it. We will do whatever we can to provide a successful program with a successful outcome.
Where can people find out more information? Is there a website or?
Our website, I think, is currently under review, but our email address is teamphoenix@aurora.org.
Perfect. We'd love for people to check out more information.
Our program director is absolutely spectacular, and she can get you either a link or find out where that new information is.
That's great. Yeah. A goal for this episode would be to get an email from someone a year from now saying, I started a program, I'm in whatever state, and look what we did. And, saying that you only, I'm using air quotes, only had 11 people do it the first year. You got 11 people to change their lifestyle for however long. And that's not, as we know in this profession, necessarily an easy thing to do. So kudos to you for that.
Yeah.
Another reason we want to bring you on the show is the Recovery Room. That's where you can find Leslie on Facebook doing this just thing right here, which is making videos. didn't want to bring you on just because you're making videos, wanted to bring you on because you're making really, really great videos, and you're sitting in front of the green screen that you use. But your videos, I love them because you bring out some personality. You use patient-centered language. And just so the audience knows that the recovery room videos that Leslie is making is pointed at the audience of patients or potential patients. So talk a little bit about what people can find at the recovery room on Facebook and the video content that you're making.
I started the recovery room in mid-September of 2018, and it has literally just exploded. You can find it on Facebook. You can also find it on YouTube. I haven't driven a lot of traffic there yet, but that's where we're going to go next. So you can search under The Recovery Room. You're going to get like 15 or 20 bars because that's obviously a popular bar name. Most of them are
perfect. That's perfect.
But if you scroll down far enough, you will see my cute little face in front of my little Apple laptop. So we're there. But it is a question and answer platform specifically for cancer patients and survivors. So it's literally directed at the consumer. And it really tries to hit the gap of answering those questions that people have. That are very, very common in our world that don't have either good answers or that answers are hard to find, or physicians sometimes just don't know. So do I need to wear a sleeve if I fly? What is cellulitis and why am I at risk for it? If I have an aromatase inhibitor and I have all this pain, can I exercise? What is chemo brain? Just the symptoms that these folks are dealing with, the neuropathy that they're living with. It's very common for people for years after surgery or radiation to still have tightness and stiffness. What can I do about that? So really looking at their issues that I see on a daily basis. I've been treating cancer patients for 20 years, which means I've been listening for 20 years. And the problems are universal. So trying to develop videos specific to that problem list. Again, like you said, keeping them fast, not wasting anybody's time, keeping them at least somewhat lighthearted and positive, and answering the question. Videos are so frustrating when, here's 3 tips to do this, and you're going to be a millionaire, and then they get on there, and there's nothing. So answering the question,
there's no content, right?
And making sure people can understand what it is, why is it a problem, why do you have the problem, and then what are you going to do to fix it? And then expectations, So it's been very, very successful. We are getting comments from all over the world, from patients. So Asia, Africa, Europe, all over the United States, and even PTs from other continents are calling and saying, hey, this is really cool. So it's really been a lot of fun. I was posting for the first 30 days, I posted a video every day. And again, I have a full-time job, so I was getting some bags under the eyes, but now I'm posting about twice a week. And then I'm encouraging these cancer patients and survivors to give me questions and then answering those. Because again, they all learn so much from each other. Well, so just kind of opening a dialogue and again, trying to reduce the unnecessary suffering that the cancer population is living with. Because, cancer sucks and it just does. And there's so many side effects from the treatments themselves, but a lot of it is unnecessary when you have a good PT on board because we can either reduce, eliminate, or prevent many of these musculoskeletal and physiological problems that people are suffering from. So that's kind of the gist of that platform.
Yeah, well, it's done well. It's several things you just mentioned. Number one, consistent. You came on and you hit them with 30 days of content in the first 30 days. It's perfect. It's relatable. It's done in conversational tone. It's what you'd hope to get from a healthcare provider if you had that question, or if you're early a diagnosis. What can I expect? It's shareable, if you know someone, hopefully, if you're going through that and someone in your atmosphere, in your solar system were to come across it, maybe they'd share it with you as well. So it's all those things. So it is, again, it's the Recovery Room on Facebook and on YouTube. You can check it out there. Just really, really well done. I love it. So let's get to some clinical stuff. What are some things that physical therapists out there who maybe haven't started yet, or maybe just beginning in their careers should know, or the seasoned clinician who maybe just wants to learn a little more, since you've done this for a couple of decades now, Leslie? What are some things that physical therapists should focus on when working with individuals with cancer?
The first thing I would say was, and it's still, even with good PT schools and the changes in cancer care, I would say that 50% of the time when a new therapist or seasoned therapist gets their first cancer patient, they just feel this level of panic. So my first answer is you're not going to break them. You're just not. These are normal, healthy people that just have got some cancer cells in them. Or they're under a treatment that, again, is just making them not feel good. Okay. So just take a step back, let the panic slide. That's not an abnormal response, but you're not going to break them. You can't damage anything. I will always say that anybody that's graduated from PT school and has a license already has a built-in skill set to take care of these patients. Okay. You need to know manual therapy. You need to know therapeutic exercise, and you have the skill set to care for them. You really do. The biggest bullet points I would have is, if you're just starting out, every single one of your patients, whether they are 20 or 95, should be on a walking program. Every cancer patient, every cancer survivor, whether they're in treatment, haven't started treatment yet, or have been out of treatment for 10 years. Walking, or that exercise of 150 minutes a week, has been shown to increase quality of life, which is a no-brainer. We all know that. But in cancer care, it can lengthen life, and it can actually decrease risk of dying from cancer.
Wow.
So right there, you have provided a huge benefit to patients just by getting them on a walking program. So that's always going to be key number one. I also encourage therapists to, in cancer care, to offer lifelong care. I mean, I think all PTs should be doing that anyway, but certainly in oncology, because you may get a patient who's just had, let's say, colon cancer surgery or lung surgery or breast surgery. Okay. And you're seeing them because they have limited range of motion, or they have pain in their chest wall or their rib cage or something. And so you do your treatment plan to make that pain go away and get their range of motion back to normal. But in cancer care, that is typically followed by chemotherapy and or radiation. So now you have a new medical management piece that is going to create a whole new set, potentially, of musculoskeletal and cardiopulmonary and functional problems. So just because your goals post-surgically are met doesn't mean your job is done. Okay. So you may need to begin even if the person has lung cancer, you may need to get them on the leg press machine, teach them how to do squats at home to keep their quadriceps or hamstrings and their glutes strong, because that's one of the best ways to minimize global fatigue from chemotherapy. You may need to put them on a shoulder stretching program or trunk rotation stretches because they're getting radiation to the rib cage and that tissue is starting to shrink. And that cancer treatment often takes up to, anywhere from 9 months to a year in some cases. So we have to learn in our profession then it's not 3 times a week or twice a week for 6 weeks and they're done. But I can see my patients once every 8 weeks. I can have them come back and follow up with me in 3 months. And I'm going to see sometimes a patient over 12 to 16 months. And that is very typical.
This is behavior modification, because you're not treating breast cancer, you're treating the individual who happens to have breast cancer. And you know that the things, even that you, again, I'm using just air quotes, just learned in PT school are going to help that person.
Right. And I will tell too, if you get that panic feeling that you don't have to know how to treat leukemia, you have to know how to treat the weakness or the balance problems that this person is having. So even if the patient comes in with this 15, 20 letter diagnosis that you've never heard of before, it's really irrelevant. Because you're going to say, Mr. Smith, what are you having trouble with? Mr. Smith, where do you hurt? How long can you stand? How long can you sit? Just get into the mode of being PT questions, and all of it's just going to start, flowing in. Another nice thing is there is so much free information on the internet now. You can go to cancer.org, cancer.gov, breastcancer.org, and there is so much information to teach you about cancer that if you want to learn, okay, Mr. Smith had some goofy kind of, acute lymphocytic like leukemia, you can go look that up, and it will give you nice bullet point information on that particular disease and typically how it's treated. And then you're still going to come back, and it's not going to say anything what a PT is going to do with that. But you just go back to being a PT. Okay, he's weak, he's tired, he can't get up the stairs, he can't stand on one foot because he's got neuropathy and he keeps falling over. That is the stuff that you're going to address in your treatment programming. Now, as you start out, it's always nice to have either a colleague somewhere in your health system that does this more often, or somebody right next door that you can.
Or Leslie on speed dial.
But yeah. Because there are going to be some things that you come across that you do not learn in PT school. Sure. That are going to be helpful to know. I mean, there's a condition called cording that you're never going to see anywhere else unless you work with people who've had lymph nodes removed from their underarm. There's drugs called aromatase inhibitors that cause arthralgias and myalgias that we can take care of. There's neuropathies from the chemotherapies that we can't fix, but we can certainly help people if they start having trouble keyboarding, or if they are having trouble getting up and down the stairs, because the sensory, neuropathy is making them not move as much, means they get weak, and then that's the stuff that comes with experience. But I certainly do want people to not be afraid to take care of this population, and know that they can make such a huge impact.
I love that you led with that, and you mentioned it several times, because I know that, even myself, in just in my rotations, working with individuals with cancer, that is the first thing that came to my mind was I don't want to hurt this person. But they wouldn't be in front of you if the things that you can bring to the table weren't valuable and needed.
Yeah. And another point I really drive home when I teach courses and when I talk to other therapists is that, when you are a PT and you are in the room with a medical oncologist, radiation oncologist, surgical oncologist, research expert, cancer nurse navigator, these are really bright people. And cancer care tends to draw really good people. But I will say that don't ever think that you are not one of the most important people in that room as a PT, because everybody is there to maximize the outcome for that patient with cancer. And that's not going to happen if you're not in that room. Okay. Because maybe their counts are fine. Their margins are clean. They're free of cancer. They're done with their cancer treatment. They have, minimal to no risk of recurrence in the next 5 to 10 years. That's all great. Those are all good outcomes. However, the patient can't walk for more than 5 minutes. They can't go back to work. They can't get dressed without falling over. That is not an okay outcome. And no matter what happens, with cancer care, surgery, chemo, radiation, those physicians don't know how to treat fatigue. They don't know how to treat radiation fibrosis or increased range of motion or increased tissue mobility or decreased tissue edema. They don't know how to teach a home exercise program. They don't know that stuff. So if the physical therapist does not do that for the patient, does not answer those questions, does not address those problems, they do not hit a maximal outcome.
Yeah, medically well, but maybe functionally sick, and that's where we thrive, and that's where we shouldn't discount the things that we know. Quote, just as PTs,
right.
It's going to help that person, get back to life. Do you want to let people know that you can post a comment below even after this video is done being live, and we'll be able to take a look at it if you wanted to connect with Leslie at Leslie Waltke on Twitter, and talk a second about your website, waltkeacademy.com. What can people find there?
Again, that's a progressing entity, but there's not a lot of oncology physical therapy specialists. There's a great group of people. If you're looking to connect to the oncology section of the American Physical Therapy Association, is awesome. So the Waltke Academy was born again out of what I call the cancer rehabilitation gap. Oncology doctors and nurses do not know enough about rehab, and rehab professionals do not know enough about cancer care. So Waltke Academy is basically right now a continuing education place. So you can come and say, hey, you want to come and teach a course for us, or do you want to come talk at a conference? But I'm slowly building in. I'm going to bring the recovery room folks into the Waltke Academy. I'm also going to start that platform, question and action platform, specifically for clinicians, called Dr. Waltke's Tip Jar. Started to bring that all in there, so we can kind of help decrease that gap. So right now you can find a little bit about information about cancer rehab. If you want some information, it's there. You can find out how to host a course or bring a course to your facility. But we're working to get some videos in there, and so people can go for free content. But that's kind of the gist of that.
That's great. I love that. Just getting more good information out there. We don't want to discount if you're just joining us on the live, the recovery room on Facebook and on YouTube. Just a good example. Again, even if you're a physical therapist not working necessarily in the oncology arena, of just how to make some good content for individuals, clients, and patients to consume, to better understand what it is that we do and how we can help them. Want to get to 3 questions. You're in Texas, right?
I'm in Wisconsin.
They're close, right? So we're gonna do three questions. Yeah, 3 questions from Aureus Medical Staffing. Are you ready for those?
Oh boy, here we go. Sure.
First question, you're in Wisconsin. Arias Medical Staffing finds PTs jobs all over the country. If you could go anywhere you want, carte blanche for 13 weeks and do your thing, your Leslie Waltke thing, where would you want to go geographically?
Okay, so I still have to do my job?
You still have to do your job, yeah.
Oh, man. If I'm staying locally in the U.S., I would probably go to my first guess would be probably Colorado. Yeah. It's a progressive state. They got good health care, and they have the Front Range. They got the mountains. They've got Aspen. They got everything out there. So and relatively temperate climate year round. So I guess that'd probably be my first shot.
Arias has positions in all 50 states, all settings as well, inpatient, outpatient, oncology. Check them out. 13-week or long-term assignments, and find them online at aureusmedical.com. Second question, what's something that you read that really inspired you that the audience should put on their reading list?
Oh, gosh, that's going to be a horrible answer. Let's see if I got it right here. Oh, I don't. I'm surprised I don't have it. I am literally reading a YouTube book right now.
What's it about, though? How to create, or?
Yeah, it is. It's about how to create. And it really is a new world, because when I talk to other therapists, they like, oh, I don't do Facebook and I don't do YouTube, and they're kind of afraid of it. And I will say if you want to know what your neighbor's brother's sister-in-law's boss gave their kid for dinner on Facebook, you can do that, and that's fine. But it's also another way to literally, it's a microphone. So if you are somebody from a professional standpoint wants to get your information to your people, whoever your crowd is, Facebook is a great way to do that. YouTube is a great way to do that. And I've learned that YouTube is the world's second largest search engine.
Wow.
So if you are, this is the way the world is going.
Sure.
And to keep up with that is really, really important. So it's not scary. It's not that hard. I'm 53 years old. I have a green screen behind me. I've got a camera in front of me. You can learn this stuff. It's not, it takes some time to learn, but if you can get through PT school, you can learn how to use a green screen.
Yeah, I loved what you just said about ways to use that medium, but also you want to speak to patients or potential patients, how they're used to receiving information and where they are. Maybe the patients want to know what their neighbor's boyfriend's kid had for dinner. That's fine. But if you can sneak in there and sneak some clinically excellent information in there, wow, what a great win for the profession and for that individual that you get to share it with, right? Yeah. So what's the book called anyway?
It's got, a very generic name, How to Use YouTube, or Tips and Secrets to Use YouTube.
Love the fact that you're going out there and finding that. That's great.
Yeah. And it's easy to read. It's good information, and it's life-changing. I literally I'm reaching people. In fact, I talked to a female rancher from the western side of Colorado this morning. She's like, I am 4 hours from the nearest physical therapist.
Wow.
Can you help me? And I said, sure, we talk for 15 minutes and changed her world.
That's a great example right there. Third question on 3 questions is, who is someone the audience of physical therapists, will stay within the PT world, who is someone the audience should know more about? Maybe someone who does great work, but they're flying under the radar.
Oh, wow. I was going to look this up because I knew you were going to ask me this question.
I'm predictable.
Yeah, you are predictable, Jimmy. It's great. I met her last year at the APTA ELC event. She is, I want to say Johnson, I think is her last name. She's one of the world's oldest physical therapists. And I'll look this up and get this information to you because it's killing me that I cannot remember her name. She is in her 90s. She has been a physical therapist for 71 years. Wow. And she stood up at that APTA conference in this crowd of hundreds of PTs and spoke for probably 10, 15 minutes, eloquently, brilliantly, about the first days of physical therapy. She didn't wander and get off topic. She was absolutely amazing. And it's killing me that I can't remember her name. But I think it's Johnson, I think is her last name. But just brilliant and motivating and inspiring to this entire crowd of obviously really brilliant therapists, knowing that this is really a lifelong profession and that it is, things are changing rapidly and stuff, but really it goes to the heart of treating the soul of the patient. And whether you have, the modalities change over the decades and our role and how patients get to us changes over, but that doesn't change. I think that was kind of her take-home message. And it was, she brought the room to their feet. It was really incredible.
Perfect. I love that. All right, you're off the hot seat. I'll get you off the hot seat for 3 questions from Arias. Again, positions all over the United States, 50 U.S. states, aureusmedical.com. Letting you do what you want to do, which is physical therapy, but the many different facets of it, where you want to do it geographically. And just so you know, Colorado is easily the #1 requested state on this show anyway. Hawaii, Alaska are definitely, California definitely up there. Last thing we do on the show, Leslie, is the parting shot. That's from Fox Rehabilitation, a practice of physical, occupational, and speech pathologists in 16 states and growing. Find out if you're a fit for Fox at foxrehab.org. So your mic drop moment, the one thing you'd want to leave with the audience, I'll put you just you on screen. What's your parting shot for PTs out there?
Let's see. My parting shot is going to be that cancer rehabilitation is medically evidence-based medical care that all patients with cancer deserve access to. Cancer rehabilitation can increase quality of life, increase length of life, and can even decrease risk of recurrence and dying from cancer. That's how powerful it is. That's awesome.
That's great. Great parting shot. Leslie Waltke, again, you can find her videos on the Recovery Room on Facebook or on YouTube. Do not confuse it with some bars, also called the Recovery Room. Find her on Twitter at Leslie Waltke, and the website is now and still growing, waltkeacademy.com. Leslie, appreciate your time talking about this really important area of physical therapy that people can greatly benefit from.
I appreciate the microphone as always. Thank you.